Do you have body pains, headaches, shortness of breath, fatigue, pain that is all over the body, or pain that is localized to a part of the body? You went to multiple doctors. They were unable to diagnose you, but they gave you multiple medications. Unfortunately, you did not respond to any of those medications. Today we're going to be talking about somatization disorder or somatic symptom disorder. In this disorder, the patient presents with somatic symptoms, including pain. The pain can be localized or the pain can be generalized. Fatigue, tiredness, shortness of breath. There is excessive emotion. The patient becomes excessively involved and emotional about those symptoms because they're not going away and they're getting worse. Of course, the patient sees multiple physicians. The physicians typically will try to explain the symptoms physically, and therefore they do multiple tests, and eventually they try to give the patient multiple medications to treat the symptoms organically. The patient does not respond. So why is that? Somatization disorder or somatic symptom disorder, it is a psychiatric disorder. The patient has psychiatric issues. It could be depression, anxiety. However, to them, it is unacceptable to bring out those symptoms in a psychiatric and psychologic form, where they go to the physician, the psychiatrist, and say, I'm depressed or I'm anxious. So they suppress him. Eventually, the brain will bring out those symptoms into somatic symptoms, acceptable symptoms in the society or in the family. That could be a person who has a high position and does not want to produce those symptoms as psychiatric, or a person who's the strong person in the family and does not want to show weakness by saying that they have psychiatric symptoms. Now, people who are at higher risk of having this, people who've been exposed to physical, emotional, or sexual abuse in their childhood or as adults, people who've been through trauma, people with substance abuse history, and people with excessive alcohol abuse. All those are at a risk of having somatic symptom disorder. Now, the diagnosis, it requires a physician with an open mind, a physician that can say, I am a mechanic. So if I cannot fit all those patient symptoms mechanically into an anatomical distribution, then most likely it could be something psychiatric. So it is based on a clinical diagnosis. However, the physician will order the particular testing that could be imaging or blood tests to confirm or rule out other pathologies. But at the end, it's a diagnosis, a clinical diagnosis. Based on the diagnosis, the patient will require psychiatric treatment rather than physical and symptom treatments. That could be antidepressant, anti-anxiety, and most importantly, psychological evaluation to go through the source of this, the source of the problem that the patient went through. If it was an abuse or if it was a trauma, if we deal with it, we solve it, then the symptoms will improve without treating the symptoms themselves. Thank you.